Hello and welcome to the latest session in the Royal Television Society's Digital Convention 2020, sponsored by YouTube. I'm Teresa Wise, the RTS's CEO, and today we're welcoming two preeminent thinkers and practitioners from outside our industry to discuss something which is dominating all our lives, public health, and in particular the role cutting-edge technology can play. Dr Alan Karthikesalingam is a surgeon scientist and he is research lead at Google Health UK. He has led landmark studies into the use of artificial intelligence for breast cancer screening, identifying lung cancer, and detecting serious eye diseases. He is also an honorary lecturer in surgery at St George's London and Imperial College London. With him is Professor Lord Darzi. Lord Darzi holds the Paul Hamlyn Chair of Surgery at Imperial College London, the Royal Marsden Hospital, and the Institute of Cancer Research. He is Director of the Institute of Global Health Innovation at Imperial College. Lord Darzi is also President of the British Science Association. They are going to discuss the application of technology and artificial intelligence, not just during the pandemic, but also how it's being used today in public health and to support the very best healthcare. I hope you enjoy their conversation. Gentlemen, over to you.
Well, it's great to see you, Ara. It's been an interesting year for us. I gather our audience today is the Royal Television Society, so maybe we can start by sharing some of our experiences of clinical work during this pandemic.
Yeah, it's been interesting is one way to describe it. It's been a challenging time too. We all work in the NHS, and the whole idea is to keep the resilience, keep up with the pressure, which as we enter into this other wave, we're seeing increasing number of infections, we are seeing increasing number of admissions, and some of these admissions sadly are ending up in the intensive care unit. So it's been difficult times, but that is what the NHS is here for. And it's keeping us on our feet, but hopefully we'll see this nation through this.
One of the things I think has been really interesting for us at work together at Imperial has been the ways in which it's made us stretch a bit beyond our normal competencies. Obviously, we got to know each other because you've been the professor of surgery for so long, but at the same time, I hear you've been undertaking some new training in ITU.
Yeah, well, that was at the beginning, actually, in February time, March time, where there was, the increasing real full intensive care beds, and a lot of our staff were going ill, as you will know. And so I decided to volunteer. I worked in the intensive care unit for about a couple of weeks. I did train in critical care, how to use a ventilator, but to be fair, I didn't have to use that skill. Most patients were very stable. So I ended up, the real heroes in the intensive care unit were the nurses. So I ended up helping the nurses in something called proning and rolling, and I'm sure you've heard this in COVID. As a clinical practitioner, I've never known much about proning, which is turning the patient on their tummy for 12 hours and then back on their back. And it was interesting experience. We've all been in intensive care unit looking at our own patients, but what was striking in this, you walked in the intensive care unit where previously you had a patient who had cancer surgery, or a patient who just been admitted from a multiple trauma, or someone who's had a coronary artery bypass graft. Here it was COVID. It really, really painful to see that. So I did that for a couple of weeks. On the odd occasion, when the rolling and the proning has been done, the beauty about no one recognizes who you are. So I had the mask on and the cover of your face, and wearing this whole PPE. So there's a little thing which says Ara, my first name, and no one recognizes you. So I remember walking to one ward in the intensive care unit, and I said, well, what could I do? And they said, well, the bins have been being cleaned. So I ended up changing the bin bags. So you do what is needed to be done. So anyhow, I think you've heard enough about what I've been doing. So tell me what you've been doing with Google and what contributions you're making for this pandemic.
Yeah, it's been, as you say, a very challenging time, and one of the interesting things about it has been there are so many ways in which technology could help. So at Google, we've been focusing on a few different areas. I think the first thing, of course, is just organizing information and trying to make that more available for everybody. Outside the hospital, of course, I think one of the hardest things is just the struggle for reliable information. So we've been partnering with the World Health Organization to release accurate information in over 200 countries now, some 70 different languages. And we've made some information panels on YouTube, which have had I understand, over 400 billion impressions. So I think for us as clinicians, the sort of public health impact of that is great to see.
Sure. What's the information you're sharing? I mean, tell me, what does it mean for someone logging in and having a look at this?
It's, I think, this struggle for sort of understanding how does COVID present. For folks who are wondering, do I have COVID, for example, they can find accurate and authoritative information from trusted sources. All the way to actually this interesting thing of testing, which is now such a major part of our strategy. So on Google Maps, for example, we are now showing accurate and live information about some 14,000 COVID test sites in over 20 different countries. Wow. So there's kind of basically helping people through their own personal experience of COVID, whether it's understanding whether they have it themselves, knowing how prevalent it is in their local area, all the way through to finding, where they can get medical help quickly.
So if I go on Google Map and say, test nearby, it will show me what it is?
That's right. For some 20 or so countries, that information is quite accurate. So that's one part of the work. I think a second part of the work has been making data available for scientists and researchers around the world. So we've been contributing information to something called the COVID-19 Open Data Repository, right, but also releasing privacy-preserving, so anonymized information about things like where populations are moving. So these are called the community mobility reports. The reason that's important, of course, is because social distancing is one of our big weapons in trying to suppress this virus. But also, when we do things like close businesses or schools and so on, it has real economic consequences. So for organizations like the World Bank or the OECD or even our big public health agencies around the world, they've been using these community mobility reports, which Google has been uploading 3 times a week for over 135 countries, to really model and understand better the impact and predicting the spread of this disease, but also understanding the economic consequences of it. So that's been very encouraging.
Fantastic. So could you pick up 100 people having a party in someone's back garden?
Yeah, that's one of the things it can't do. So, although of course it's great to know where the parties are happening. One of the important things about privacy here is that there's a minimum size of area in which you can report. But it does tell you interesting things like the proportion of folks who are in places of work, for example, or places of retail compared to the same time a month ago.
Yeah.
And that helps, I think, governments understand at a high level the degree to which the economic impacts are being felt of different policies. The other thing that's been quite good to see has been this partnership with Apple, providing some basic privacy-preserving standards for contact tracing app design. So these standards are then used by countries and public health agencies, each of whom make their own apps for contact tracing. And now 40 or so different countries, very proud to say, including England and Wales, as you know, are now using this Google-Apple combined interface to design strong apps.
And I think you won the hearts and minds of people because of the privacy settings, and the data is not shared centrally, and all of the difficulties and the challenges early on. Well, that's fantastic. That's brilliant. And just tell me, how is that data then used? So I'm sitting beside you here, our mobiles are on. So if you have an infection, if I have an infection today, you will get a signal sometime when I get tested. Is that the way it works?
Similar, yeah.
Just privately?
Very privately. Most of these contact tracing apps So in the NHS one, for example, the way the NHS app designers designed it is that you or I would have to enable that. So we consent each on our own individually. But if one of us turned out to be positive for COVID, then the idea would be that because we're now spending more than 15 minutes, probably just under 2 meters apart, you would later get an exposure notification so that you would be made aware that you've been in close contact with someone else who had COVID.
Well, it's fantastic to have that empowerment as a citizen, isn't it? It's a brilliant piece of work. Well done. Anything else you're doing on the pandemic besides what you've described?
Yeah, I mean, I think some of the other interesting things here, I think, has been more on the research side. So how machine learning and artificial intelligence is also being used to try and combat this virus and help us understand it better. So there's a raft of work going on there, all the way from understanding the molecular structure of this virus. So our colleagues at DeepMind have been using some cutting-edge artificial intelligence, similar systems that, a few years ago were being used to do things like play chess or play Go. The same systems are now being used to predict the protein structure of this virus, and that's a great weapon for other researchers around the world in this race to design vaccines or other therapies to combat it. So researchers at DeepMind have publicly released all of their findings and their predictions about this protein structure so that other, more expert biologists and other people around the world can use that information to build therapies. And then similarly, across Google, various machine learning teams are releasing tools and technologies for doing machine learning at scale that can help, specialist experts in public health agencies and universities around the world better model and better predict the spread of COVID in different ways.
Fantastic. So, I wrote something about this in The Guardian about 4 or 5 months ago, where it was a plea to pharmaceutical companies who, as you will know, have stacked up large number of molecules on their shelves. Just take an example. In 20 years of trying to discover a therapeutic options for HIV, there were a lot of antivirals out there. And do you think you will have the capabilities, as a group in MIT have done, which have discovered a new antibiotics, which is not resistant to bacteria? Do you think potentially artificial intelligence may have a role in discovering some new therapeutics as we go into this other wave of COVID globally?
Yeah, I think it's a very interesting question. I think in the case of things like drug discovery, for example, the MIT example you mentioned is a really good one of how many big pharmaceutical companies around the world and universities involved in drug development are using machine learning to try and make their selection of promising candidate drugs more efficient. I think one of the most challenging things about COVID in particular is that because it's such a new virus, the kind of clinical data about which treatments work and which treatments don't work is so new that probably it's too new for artificial intelligence to help at that end of the scale. And we see more actually just traditional things, randomized controlled trials, the recovery trial in Oxford, where the NHS is really leading the way, helping us understand which treatments work really well and which treatments don't.
Sure. And I think we need to share this data with some of the brains you have here. All of this anonymized data, it's not an identifiable data, but you can see then from the different trials, which is fantastic. This is really, that's the only way to get us out of this. We put a lot of hope in vaccine, which I'm sure it will deliver, but at this stage it'll be good to get more therapeutics. So tell me about other areas of healthcare. You didn't start with COVID. This hit us out of nowhere in February, but Google and DeepMind have been actively involved in other areas of research. So give me some examples of work that you've done.
So as you know, for us in DeepMind and in Google, much of this started with the application of machine learning to healthcare settings for research purposes. And the field of machine learning really has had tremendous progress in the last 10 years, but particularly in the field of computer vision. So computers learning from repeated experience how to understand what's in a particular image. And this, for us, was very exciting for improving the accuracy and availability of healthcare in many areas of medical imaging. So one of our most exciting projects, I think, has been some work on breast cancer screening. As you know, for example, 1 in 8 women are going to get breast cancer at some point in their lifetime. And many countries, including England, will therefore run these big national breast screening programs. And so just as in the way we doctors learn from experience, I think an average radiologist will look at more than 10 million images in their career, and most of them tend to get better over time. In the same way, we can train these machine learning systems to interpret X-rays and breast screening X-rays, for example. So in some research where colleagues at Imperial were key collaborators, funded by Cancer Research UK, we trained a machine learning system to identify breast cancer with the same level of accuracy as expert radiologists. So we're now working on the next stages of that, which will be building that in a safe fashion, in compliance with various regulations and so on, so it can be a medical device that could then theoretically be made available to health systems to help complement expert radiologists who, as you mentioned at the start, are under significant pressures of work. So trying to kind of provide these diagnostic assistance and tools to expert doctors at the coalface.
Fantastic. But still, at the end of the day, a radiologist will have to sign the report. Would you say so? Or?
Yes, I think that's certainly how things are for the time being, of course. Very difficult to predict the far future, but the way I think most people are looking at machine learning in healthcare now is as tools that assist experts to be more efficient and to be able to do their job, at the absolute top of their game.
Yeah, and the way you've described this, you separated artificial intelligence from machine learning. So I presume when you've got to the level of showing that it is as good as radiologist, but that machine will keep learning beyond the 1 million, or what did you call it, 100,000, 100 million? How many does a radiologist look at?
I think one radiologist will see something like 10 million images
10 million.
in a career.
So this machine could look at 10 million in a week. So what happens to the second 10 million? Do they get better?
I think it's a very interesting question. We have definitely seen that there are some kinds of medical imaging tasks where the ceiling of how good you can ever be in terms of identifying cancer in an X-ray, for example, is limited not so much by the person looking at the image, but by the quality of the image. So you can as an example, you could imagine taking a photograph of a cat from a distance, or of a number of cats from a distance. But if you're standing very, very far away, then it doesn't matter how good you are at counting cats. The photograph might be too blurry and you may not see. On the other hand, there are some really interesting examples that we've seen where it's also possible for these machine learning systems to learn and identify patterns that weren't particularly obvious to us as physicians. So one good example is people have long thought that the eye could be, the window to the soul, but also the window to overall human health, because behind a clear lens, there's information about blood vessels and nerves and more. And so there's been some very interesting research done here at Google, but also with Moorfields Eye Hospital, looking at these images of the back of the eye, the retina, and showing that machine learning systems can use that to find predictive information about the rest of the body's health, for example, how likely people are to have heart attacks or strokes in the 5 or 10 years that follow. That's very early stage research, but I think is a really interesting example of the kind of thing you're alluding to, that maybe with more information and more research, we might uncover new things in these images that we couldn't see before.
Absolutely. And obviously, the machine doesn't get as tired as I would be at 5 o'clock on a Friday afternoon just before going to work. So the fatigue element also is quite important. And we've seen plenty of evidence of fatigue certainly in the COVID era with our colleagues. Now, could I just come back from the point of view of the engagement with the patients and the public? When you talk about machines or machine learning, it reminds me, and it takes me really back to about 1999 2000, about 20 years ago, we just commissioned a robotic system in our operating theatre. And in those days, I remember my very senior fellow who was consenting the patient to have an operation, and they were supposed to be having I think it wasn't a major, but it was a tummy operation. And I remember getting a phone call from the fellow to say the patient is very upset to hear that they've made this journey to be operated on by me, and they've just heard that it's the robot who's going to operate on them. So I spent about 45 minutes with that patient trying to explain to them. In actual fact, a robot is just a tool. It's a sort of a sophisticated surgical instrument where I'm still in control and I'm doing the operation. And that took a lot of time. But what I learned from that is if we don't explain to the public and the patients, what is this technology for? It is substituting a human. There's going to be a lot of anxiety related to that. So how do you plan to do that in Google in terms of many of these? I mean, a robot is a frightening concept. This is mostly a software reading an image. But again, you know, we're all humans. We would like to know that quality assurance. What are you doing in that area?
I think it's exactly as you describe, actually. I think patient engagement is key. But there's also this very interesting and important principle of participatory design. So we find that if you include patients in these projects from the very beginning, then that guarantees that you build the systems in ways that are more acceptable to patients and the public. I think it's probably much more common in software and medical research than it is, for example, in robot design. But for the breast cancer project, it's a good example. From the very beginning of that, we worked with Imperial's Patient Experience Centre and had survivors of breast cancer as well as current patients involved in advisory committees and so on throughout the project. And I think that helps make sure that the way these systems are built is with patients' interests at heart. But I think beyond that, when these systems get released and used as tools, the requirement is still going to be there. It's going to be very important that there's careful communication at all levels, not just by the companies developing these tools, but by all of us as doctors when we use them, so that people are comfortable that these tools exist and that they're being used as part of care. How have you seen these kind of technologies change practice in the pandemic? What's been the good and the bad for you?
Well, it's been a challenge because I'm a surgeon, obviously. So the difficulty in the beginning was, life is about trade-offs. So you have a patient with cancer who obviously they need an operation done. But at the same time, you don't want to bring in a patient with cancer who's just had chemotherapy to an environment in which the probability of them getting COVID is high. So I think in the first wave, the policies were very clear, is to avoid, obviously, coming to hospital to protect the patients, although the motto was also to protect the NHS, but that's really, NHS's protection is to protect the ones who use the NHS. But I think as we move on into more recently, the NHS has been reasonably successful in, if you like, segregating what is COVID, what is light COVID, because you never get rid of COVID, wherever you happen to be. And obviously technologies like robotics and others will be very, very useful because there is that separation too. But I've no evidence to prove that. But it's, technology has had quite a big impact in helping us. And I think the one that really took us by surprise, now, if you asked me about a year ago, how many patients would you be doing a remote consultation on? And I would have said 0. That has completely transformed. I mean, we've moved from nothing to millions of tests, of remote consultations. In other words, us sitting down in front of a television and having a discussion with the patient. I think a lot of that will stay with us because it's good, it's efficient, but I think not to the extent we have it now, because I think some patients probably, as a clinician, I would probably like to see them. You cannot feel a tummy on a television screen. You can. There are certain tests that you need to do which you cannot do on a television screen. But it's been fantastic in keeping the system really, really running. And I think, machine learning tools that you may develop could also help many patients to, if they enter their symptomatology and what they're complaining of, actually, in fact, direct them in different directions. So technology is one way to get us through this, whether it's machine learning, as we all know, diagnostic tests, which we all know are absolutely critical. The only way out of COVID is testing and testing and testing. And I think your type of technology will have a significant role in doing some form of mathematical calculation to compensate for, we talk about the sensitivity of a test, and, if you repeat the test 3 times, you get a better sensitivity, all of that, which is a complicated algorithms, really. And I think, people like you could help us a lot in getting there. So I think we said enough about healthcare, but obviously this type of technology platform has a considerable role to play in media, TV, radio. Just tell me a little bit how could we translate, or how are you translating these in other sectors, media being one example that obviously our audience is very keen to learn from?
Yeah, I mean, I think probably the audience will know a lot more than me about this, because I feel like many of the sort of pioneering uses of machine learning have been in consumer technology, in the media and broadcast sector. It's interesting, I think machine learning is a very general purpose technology in that sense. It's a bit like electricity or something. You can find it useful everywhere. At its heart, one of the things it's really good for is pattern recognition in these complex data sets. And so I think one of the places you see it used most commonly in media and broadcast is recommender systems. So helping improve, the user experience through personalization and recommendation systems. So, if you're a user of a particular media service, the idea that you can be recommended other things that you would also, be delighted to watch and enjoy. I think there are some interesting parallels between, use in industries like media and the consumer sector and more safety critical industries like healthcare. A good example would be algorithmic bias, where if we're learning to recognize these patterns by building machine learning systems from training data, then if there are societal biases or other kinds of bias inherent in the way we collect this data, and we then sort of repeatedly train pattern recognition systems using that, it's possible to build these biases in a way that makes them permanent or even amplifies them when we turn them into tools and technologies. So certainly in the healthcare industry, that's something we have to be very careful about when doing machine learning in healthcare.
Absolutely. And what about, would machine learning have a role in picking up some of the biases in terms of some of the messaging that might go out we are all, we live in a democratic society which is underpinned by ethical values. So tell me, what is Google DeepMind doing in terms of ensuring that the system is not spreading misinformation?
Yeah, I think that's a very good point. So there are very important teams in trust and safety that work kind of across Google's various products and services, focused exactly on this. So on identification of misinformation, and then building systems that can detect that and remove that as much as possible. That's one part of it. I think the other part is, especially for sort of things that really are important in terms of safety, like healthcare, partnering with trusted authorities to offer curated knowledge panels and things like that, which are now increasingly available on Google and on YouTube for specific healthcare conditions. COVID being one of them, and of course there are many others.
Fantastic. anything else for the future? What will the future look like from 10 years from now in terms of what other products or services that you believe machine learning will have a considerable impact in the improvement of the quality of life of mankind?
I think one of the interesting things we will see is increasingly this trend in fitness and wellness, which is fairly new over the past kind of 5-10 years. Things like these smartwatches that we wear measuring our heartbeats and our step counts and our activity, all the way from this through to when we get sick and are in hospital, our records being digital. I think over the next kind of 10 or 20 years, we'll start to see much more digitization of our well-being and our health in this way. And it's possible, I think, that will unlock new insights that we just haven't been aware of in the past, because it's, we today learn these normal ranges, what's a normal heartbeat, what's a normal temperature, what's a normal pattern of breathing. And the potential for all of that to be much more informed by real data that accrue across decades may mean that we can achieve a much better understanding of health and disease, and hopefully can identify ways to intervene earlier and prevent folks from getting sick before they do. That would be, I think, my great hope for all this. It may take a long time.
So I think I've asked you many questions. I'll leave you with one other one. I mean, what COVID has done, which is shocking globally, it's really displayed very nakedly in terms of certain communities. Black and ethnic minorities is one. The elderly population who've been isolated. How could we, how does machine learning and these technological tools, what's your plans in engaging that community in terms of empowering those citizens as we move on and what we've learned from COVID?
Yeah, I think that's a very key and important question. I think one of the interesting things here will be this focus now of major technology companies in sectors such as healthcare brings by definition a focus on communities that are more vulnerable, more frail, particularly, as you say, the elderly and so on. So I think we're going to see a raft of kind of interesting developments in the next few years about assistive technologies for those people who are maybe more elderly or have more care needs in place. You can imagine the kind of developments that are going to come, whether it's anything from falls prevention to helping with nutrition and well-being, easier access to healthcare, and these kind of things. So I think that we will see big changes in that over the next few years.
Fantastic. Well, on that note, just to say, you're doing an amazing job here, and again, well done, and thanks for all your help during COVID, and keep up the great work. Thank you, Alan.
Thanks, Ara. Great to see you.
Thank you so much to Professor Lord Darzi and to Dr Alan Karthi for such an insightful conversation covering health, extraordinary technology advances, human behaviour and the societal impact of these. Thanks also to YouTube for the use of their space, and look out for further sessions with the industry's senior leadership in the coming weeks.